Dear students, we'll discuss a condition which is again commonly kept as a short case. Very interesting, rather. A differential diagnosis or many situations. So I'll just see that. Let's see this case scenario. What are the differential? It's not a single entity you can think of. You may have to think of many conditions. See, so look at this. Look at this. It's in the groin area, actually thigh area. There is a lesion. There is some sort of proliferation. There is everted edge and surface is irregular. So not a difficult thing to say that it is probably malignancy, because look at this, it is for any clinician they'll say it is a malignancy. Of course, one of the differential we may think of pyogenic granuloma, that is a different thing. Other everted edge, this everted edge is very typical. You have to think of malignancy. So what are the malignancy you think of? First thing is squamous cell carcinoma. Second important thing is skin adnexal tumor. Third thing is amelanotic melanoma we can think of. Fourth is you can think of some soft tissue sarcoma, probably dermatofibrosarcoma, protuberance like that. And some benign entity, I said pyogenic granuloma, unlikely. Actinomycosis you can think of, tuberculosis you may think of, scrofula, otherwise scopuloderma, but there are different features scopuloderma, not like this. So all those conditions are ruled out, but imagine, think like that also. Anywhere when swelling or ulcer comes, you think of congenital, inflammatory or infective, neoplastic, others. So neoplastic is the first thing you have to think of. Inflammatory, think and rule out. Maybe tuberculosis, maybe actinomycosis, maybe just pyogenic granuloma. But it's unlikely you will not give that diagnosis in this patient, but keep it in mind as far as classification is concerned. So this is malignant, this is malignant. Mostly you have to think of when you look at this one as a case scenario. The again important thing is feel it, check the mobility, check the induration. Induration is a very typical feature. Check the extent of the induration and whether it's attached to the deeper plane like muscle and fascia by checking the mobility. And after contacting the muscle underneath, again check it. Then regional lymph node here, of course. I like to have inguinal lymph nodes you have to examine, external lymph nodes you have to examine and see what stage it is, because external lymph nodes are in node. That means it is a it is further staging. It denotes the poor prognosis and further staging actually. But ileoinguinal resection has to be done in such a patient. So here keep the differential diagnosis in mind. Everted edge gives a very good clue. Proliferation look is a very good clue as a malignancy. And of course, so feel it for induration, mobility, texture, extension, and groin lymph nodes, systemic examination. All the things are important. Other area to examine also important. And wedge biopsy from the edge is the initial investigation for histological diagnosis. Then MRI of that area is important to the extent. And CT, chest and abdomen, because if somewhere you thought of it is aggressive malignancy, and if somewhere if you think of it, it's a sarcoma, chest and CT, chest and abdomen is important. CT scan may do some people, but in this situation, it's not the ideal investigation to jump into the PET CT. CT chest, CT abdomen and pelvis, MRI of the region may be the adequate evaluation method after wedge biopsy from the wedge. And so treatment is wide local extension, adequate clearance, may have to be a frozen section, biopsy in OT itself. Depth also very important. Depth clearance wide, then reconstruction, maybe a local rotation flap or primary closure or skin grafting is sufficient. Additionally, which is important, is ileoinguinal dissection, because inguinal lymph nodes will be in node. Mostly it is a cutaneous, any cutaneous skin adnexal tumor, malignant skin adnexal tumor. You know that skin adnex sweat gland, sebaceous gland, and hair follicles. These are the skin adnexa. So any malignancy from it can be benign or malignant. Here anyway it is malignant. So skin adnexal tumor also treatment strategy is almost same like squamous cell carcinoma, but markers are different. So in tissue you have to always do different specified markers for skin adnexal tumor, which gives a very clear clue about whether it's squamous cell carcinoma or skin adnexal tumor to have a final pathological diagnosis as such. So ileoinguinal blockization is important in this patient. So that gives the staging also, that gives the clearance also, that gives that is also a part of the therapy. Additionally, you have to give the chemotherapy and radiotherapy as adjuvant in this patient, and of course proper follow-up So markers and grading are very important things in these patients. This is the differential diagnosis I said already. Sarcoma, soft tissue, amyloidotic melanoma you have to think of, other than squamous cell carcinoma. These are the things which you have to remember as a differential diagnosis when such lesion, when you see in a patient. Don't forget to examine inguinal lymph nodes as such, and don't forget to stage this patient. Wedge biopsy, MRI, CT chest and abdomen. It's fair enough investigation. Note the proliferative lesion and event. That gives a very clue that it is a malignant entity, not benign, and it can be infective inflammatory condition. There's a question will be asked in the viva or clinical when you present a short case, more, less unlikely. So if but tuberculosis, actinomycosis, they present differently. Pyogenic carcinoma may present differently, but you will be asked to be able to justify that it is not because everted edge, induration, not a features of tuberculosis or actinomycosis. So exactly you should be able to explain. So to think but rule out is important thing. Think widely in clinical, have a clinical sense in such a patient. That's important thing you have to remember. So management already told what other exams, internet, mobility, fixity, play, next I already told. I know the lymph node, limb examination, distally, abdominal systemic examination, respiratory. All these things are important. Complete exam, complete clinical examination. It's very, very crucial in this patient. And wedge biopsy already to CCT, abdomen, pelvis, chest, groin, tumor marker. Already for tumor marker different for kinder desert tumor. And wide local excision with the ileoanal resection, the treatment, and add on to the chemotherapy as adjuvant therapy depending on the type of the malignancy, grading and staging as such. So students, please go through my manual of surgery. Skin tumors topic is there. In that every detailed explanation of each skin tumors are given with the proper anatomy of the skin, because all layers you have to know, epidermal layers, dermis, it's a different receptors are there, everything you have to know. And so go through my skin tumors topic in SRB manual surgery, and meantime go through my clinical methods in surgery as further reading, ulcer examination and swelling examination, so that I have a proper idea of the examination of this, clinical examination of this thing, clinical diagnosis, management concepts from the my manual of surgery as further reading. Please go through that and answer the MCQ. So for that, I put it in the comment your answer afterwards, and I will acknowledge it and I'll give proper explanation also for that eventually. And meantime, I request all of you to subscribe my channel and request your friends and colleagues to also to subscribe, because it is free and it's a daily basis. We got a brief lectures, mainly case scenarios, and with the MCQs and proper healthy quotation for your enlightenment as such. So answer this MCQ. Pre-cancer lesion of skin is A, B, C, D. Find out what is it and put it in box. And marginal ulcer is locally malignant, loco-regionally malignant, systemic malignancy, not a malignant condition. Again, put it in the comment box. I will acknowledge that your answer and give the proper explanation eventually. Again, I requesting please subscribe my channel and request your friends also to subscribe for the get better surgical knowledge of different small topics on day-to-day basis. So quotation of the day is, be strong by knowing your weakness. Essential quality for others. You should be strong in surgery. You should know your weakness also. That's how you become strong. Your weakness, you improve your weakness. Further, to improve your weakness, you have to identify your weakness. That's important. So that's how you become strong. That's very, very important for surgical profession, surgical career. So learn your weakness and clear your weakness, be strong. That's how exactly most important in surgery. So students, please go through my SR-based clinical methods in surgery, current edition, which gives in detail about the clinical exams, all chapters, including X-rays, other images, basic instruments, specimens, and gives very lot of photographs are there, figures, illustrators are there for your benefit. Detailed clinical methods and case sheet rating is there. That's very important for clinical surgery. And manual of surgery current edition gives the detailed discussion of all topics, specialties, urology, cardiothoracic, and other chapters, including instruments, operative surgery specimens, as per CBMA syllabus in detail for your knowledge, exam, theory, clinicals, everything. Please go through that. And of course, my operative surgery book with the 2 volumes is very useful to understand the every operative procedures with the step-by-step technique, and my atlas of tissue approximation, small book with a video. All this contains a video of the demonstrations of different things. It also gives a suturing technique very briefly, very nicely, and with the principles. Please kindly go through that. And my SRB surgery insights and YouTube different channels, my website. You can please subscribe. That will give a lot of information, and it will very well benefit for all students. And please subscribe my SRB surgery insights of different modalities for understanding better knowledges and subjects, because best different best topic, different versions are there in small topics in the website. And this is the QR code for the same. Students, I hope you understood this lecture very well. I again request to subscribe my channel and go through my clinical method surgery book and SRB's manual of surgery for your further readings. Thank you so much.